This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. We're all probably familiar with the blue parking tags that hang from the rearview mirror, allowing easy access to designated parking spaces for those with a disability or qualifying condition. Around 200,000 people in the state use these tags. That's according to a March report from the Connecticut Examiner. Connecticut's Department of Motor Vehicles began phasing out the permanent or lifetime versions of those tags almost 15 years ago. This is to help curb misuse, linking placard renewal with a person's license or ID. Some advocates and lawmakers are hoping more can be done to regulate how these placards are issued and how misuse might be enforced. For example, one bill that just passed this session would ensure a person's doctor certifies the need for a parking pass versus an online telehealth provider, for example. Coming up, we hear from House Republican leader Vincent Candelora, and Transportation Committee co-chair Senator Christine Cohen, who both testified for that bill. Plus, Connecticut Department of Motor Vehicles Commissioner Tony Guerrera will discuss the recently formed Accessible Parking Advisory Council. But first, joining me now is one family from North Branford that has been advocating on this issue. We have Alexandra Bode, who's the executive director for the nonprofit Peace, Love, and Accessibility. Thank you so much, Al, for being with us this morning.
Thank you.
And alongside her, also her fellow advocate, is her older brother, Sam Bode. Sam, thank you so much for joining us today.
Thank you.
And also with them are their mother, Mary Caruso, who is the PLA founder. Mary, thank you so much for being on Where We Live today.
Well, thanks for allowing us to talk about it.
And for our listeners, have you or a loved one with disabilities had issues with accessible parking? Or if you have any questions, you can join the conversation, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. So I want to start the conversation off with a question for both Alex and Mary. Can you talk about what brought you and your family to begin this nonprofit, Peace, Love, and Accessibility? What are some of the things that you've observed in your neighborhood, Al?
Well, there.
Yeah, I think for Al and obviously Sam, they got to a point where it became increasingly more difficult to access places in their community that they, love to go to. And Al just said, one day I'm really tired of it.
And can you talk about some of the things that you observed in your neighborhood? Was there something specific that kind of started this?
What's the number one? The number one problem we've encountered is people parking in what's called an access aisle. So every so many parking spots, I believe 1 in 6, there's a van spot for people who use a ramp van, which Sam and Al both use. And that access aisle allows you to open up your ramp, exit your car, and go about your business. Time after time, they'd come back to their car, their van, and there'd be someone parked in that access aisle. It's happening almost daily now. And we see that as an unmet need. I believe most people just really didn't know that is not a parking spot. Al, you did a lot of posts on your Facebook, on your social media about it, correct?
Yeah.
And so many people reached out to her to thank her and to ask questions. So I think that was the number one problem. We still see a lot of the lifetime placards out there. We picked one spot in North Branford for 1 month, and we quickly photographed illegal placards, and we came up with 108 illegal placards, both lifetime and or expired, or even people who cut and paste out of magazines to make up their own placard.
Wow.
So the time had come.
And we will be discussing that in more detail throughout this conversation. But I also want to point out, Mary or Al, you had flyers for these instances, right?
We do.
Yes.
Can you talk about that?
Al made up very friendly cards to alert people that are in violation. There's one for access aisles, one for the lifetime placard, one for people parking without a placard, and one for expired placards. So when we see a car, we're very careful because we have a friendly mission. And if the opportunity arises, we'll slide a card under a windshield wiper to let people know. And it's a friendly reminder, either not to park there if you don't have a placard, or the lifetime placard, they need to visit their physician or practitioner to get a new placard. So Al developed those early on.
And talking about the friendly mission with that in mind, Mary, this is not a conversation meant to inspire listeners to become vigilantes for parking pass usage or to make inferences about what is or isn't a visible or invisible disability. Can you add more to that?
That is so important, Catherine. Thank you for bringing that up, because we have a very hard stance on people with placards, people with legal placards. That is between them and their healthcare practitioners. It's not for us to judge whether they should or should not have that placard. We really found that there were so many illegal placards out there, and so much of the public that just didn't understand the importance behind, DMV's placard program, that we thought through education and public awareness, we can make some level of change. And I do believe it's working. Correct, Al?
Yes.
Anything else you'd like to add, Al?
Mm.
No, that's okay. We'll come back to Al throughout the conversation. And Mary, with what, with the process that you've been talking about, there's movement, there has been some change, especially with the flyers and the cards that you're leaving on people's cards. Can you also tell us, related to the process, the survey that you all put together, what was it for, who is it for, and who were the different groups who received them?
Al, do you want to weigh in on that?
I know we had a few, and they were for grabs.
Yep, we did 4 groups. And again, I mean, I'm Al's wingman, but she really is the force behind all this. I want to add, she does have her master's in social work, and she's always wanted to help people. So, although Al, we joke, Al hates to talk and I talk too much, so we make the perfect pair on this mission.
Clearly, as we're hearing right now.
But she did some research and decided that we should have 4 groups. We should have the general public. We should have survey placard users, law enforcement, and healthcare practitioners that are the ones that, fill out the paperwork and decide on the, whether the criteria is met to get the placard. We had a really good response from the general public, over 150 so far. Placard users were at around 75. Although we think that some of the placard users may have spilled over into the general public. We're still trying to escapulate the, data. Police officers are getting better. It's been a hard sell, but we're at 23. And unfortunately, providers were just not having luck. Our healthcare providers at Hartford Health have really rallied around and helped us to obtain 15 surveys. We did, however, get to connect and have some good conversation with our personal providers across the array of specialties. And we unfortunately are finding that a lot of healthcare providers, some didn't even know there was criteria around qualifying for the placard. And there is a big gap in communication with healthcare professionals. So our next move forward is really going to try to connect with them, maybe rely on the DMV to help us, just to help with the education piece for healthcare providers, because that's critical.
And so was the survey, did you start the survey? Is it kind of an informational thing to get to understand what everyone knew, or what was the survey for?
Absolutely, to find out, what's important to people, what we should focus on. And honestly, placard users, what we found immediately is so many are telling us that they're just not going out in the community anymore because it's just become so difficult to access, through parking and honestly into businesses, healthcare facilities, places out in their community. So, we did decide on accessible parking as our first goal because that seemed to be the biggest need. But we are collecting a lot of data, and it is helping us, with our social media, with our public awareness, and with our education piece for people.
And we're going to have someone who responded to that survey joining us now, and who has also since partnered with PLA is East Haven Police Department Captain Joseph Murgo. Captain Murgo, thank you so much for joining us today.
Good morning. Thank you so much for having me. Appreciate it.
Well, and so you've been listening to the conversation. I want to ask you, how did you first hear about the Bodes effort, and why did you get involved?
So Alex reached out to us in January, and it was just a simple email, just introducing herself and introducing peace, love, and accessibility. And basically just, said what she says all the time. She wanted to start the conversation. And as soon as we looked into the organization and we met Al and Sam and Mary, we knew that they were onto something. It was clear they were, passionate about their cause. And it really was a conversation that needed to be started. And we were glad to sit down and chat a little bit more about it.
And with that conversation, did it surprise you with the concerns that they're bringing to you? What does enforcement look like from your side of things? How do you quantify how big of a problem this is in your town or across the state?
So it's super visible, right? You could
Right.
pull up to a restaurant or a quick to go spot or a coffee shop, and you can see almost every time you drive by or pull in, somebody parked, maybe not necessarily in a handicap space, but usually parked in the hash lines where the access aisle. And it's just simple awareness. It's just simple education. People don't realize what that access aisle is. And they think to themselves, well, it's better than parking in the actual handicap space.
Oh,
And if they don't, realize that the access aisle is used for, loading and wheelchair accessible loading and deloading, it's glaring that you don't know what you don't know. And that's why we're happy to partner with Alan and her team to bring that awareness to our community.
And can you talk about the PSA that you are a part of? What do you want the public to know?
Sure. Enforcement requires a combination of education. Do people know the laws? Do people know what those different areas mean and what they're intended for? Awareness, which is the Visible campaign, which is the PSAs. And out of that, we hope to sort of launch a little bit more consistency and enforcement and, dedicate adequate resources. So the PSA is basically a launch pad. It's to introduce, this initiative to the community and at a wide spectrum. And I'm pretty confident that people are going to learn something once they see it. And they're certainly going to meet Alex and Sam and Mary and understand how passionate they are and how serious this concern is for us and for them.
Well, you've been listening to Captain Joseph Murgo. Captain Murgo, thank you so much for your time and sharing your experience with us.
Thank you so much. Appreciate it.
And Sam, I want to bring you in here real quick because your mom has told us that a lot of placard users felt discouraged because of some of these experiences that they've had or some of the things that they've witnessed, like what Captain Murgo just shared with us. Does that resonate with you, Sam?
Yes, it does, because I've began. I like Alex. I was sick and tired of everyone using handicap placards, and it's gotta stop.
Mary, do you want to add to that too?
Yeah. Sam is very different than Alex. Sam will have no qualms about saying things up front. But I mean, it is true. We've heard a lot of stories. It's very common, unfortunately, in universities where students will grab a relative's placard because most parking is off campus. We have heard people brought specific stories to us, and we have tried, to reach out to people to, just through lived experience and storytelling to help them understand, what their actions are actually doing, like taking away from people that need it. But Sam doesn't have the same tolerance level, which is why Al does most of the work.
Well, once again, that's why the world is balanced. The three of you are the perfect trio, it sounds like.
At times.
Well, you've been
but Sam did want to say one thing that was important.
Go for it.
Why don't you go ahead about the surveys?
Yeah, so I think if anyone's listening and they do wanna participate in a survey, find the surveys out of Facebook.
Right. So Sam's trying to pitch the surveys for Al.
Got it.
So good point.
Well, that Facebook page is linked on our website at ctpublic.org/where we live for those listeners who would like to be involved. So we're going to go to a quick break. You've been listening to Mary Caruso, Alexandra, and Sam Bode, who are behind the nonprofit Peace, Love, and Accessibility. If you or a loved one have had issues with accessible parking, or if you have any questions, please join the conversation. 888-720-9677. That's 888-720-WNPR, or leave us a comment on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. This hour, we're discussing accessible parking and some recent efforts to better regulate parking tags here in Connecticut. We've been hearing from the Bode family in North Branford, including Alexandra, the executive director of Peace, Love, and Accessibility. They're all still on the line with us, but joining me now to discuss a bill that went through this legislative session related to this issue is House Republican leader Vincent Candelora. Representative Candelora, thank you so much for joining us today.
Thanks for having me.
And we also have with us Transportation Committee Co-Chair, Senator Christine Cohen. Senator Cohen, thank you for being with us today.
Thank you, Catherine.
And so, Representative Candelora, want to start with you and dive into this bill that we mentioned earlier. Can you tell us, what will this do to better regulate accessibility parking passes?
Well, I think we're trying to maintain the spirit and intent of how we go about issuing handicap accessibility passes, and that is that it should be through a doctor-patient relationship, a treating physician. What we are seeing is technology is changing in healthcare. People are moving to online platforms, and it could be good and bad, but we want to make sure that we don't have this become sort of a proprietary enterprise where people are just making money off of it by offering a service online or through the internet where they can sign off and issue handicap placards without actually having that doctor-patient relationship to assess properly whether or not somebody is in need of one.
And Senator Cohen, can you talk about why is this such an important issue that needs to be legislated? It doesn't sound like it's an old issue, so why now? Or a new issue, I should say.
Yeah, I mean, and first let me say, Catherine, I'm privileged to represent such staunch advocates for the disability community in Mary Crusoe and Sam and Alex Bodie and the rest of their family and friends. Both Representative Candelora and I have been working with them for years to tackle the misuse and fraud related to accessibility parking placards. Wow, that's a tongue twister this morning. We've all seen the misuse of these placards, the able-bodied parking and spots reserved for those with disabilities, and the fraudulent issuance of placards by doctors who may not have a true understanding of their patients' needs. So, this misuse really not only undermines the integrity of our accessibility programs, but also creates significant barriers for those who genuinely require these accommodations. And I think our constituents with disabilities face numerous challenges in their daily lives. Access to parking spaces designed to accommodate their needs shouldn't be one of them. And I think we both Representative Candelora and I realized in working with them that by cracking down on fraud and misuse, we are really ensuring that these vital parking spots are available to those who truly need them, enabling greater independence and mobility for individuals with disabilities. So we've been working with our Department of Motor Vehicles. We did, in past legislation, set up an accessibility parking council, and I'm proud that work has begun at that council. But I think in the meantime, Representative Candelora and I have really been trying to come at this, and he came up with this idea, and presented it to us, and we really thought it was something important to do in the interim while the Placard Council was really getting to work on other issues to address in this realm.
And Representative Candelora, we've heard from law enforcement earlier talking about how enforcement is a very multi-layered issue, and there's a lot of moving parts here because the people involved, it's not just doctors or DMV or police. So can you talk about, what are your hopes for the Accessible Parking Advisory Committee, which was recently formed under the DMV?
Yeah, I mean, I think there's a lot of moving parts when it comes to handicap parking. Looking at Connecticut used to have the lifetime placards, so how do we sort of rein those in and make sure that people understand that those are no longer valid and we need to go toward the placards that are expiring? Also coming out with ways to educate people with the parking spaces, not just the individuals that use them, but also the businesses that have them. We talk a lot about in the public sector, we have public parking spaces with handicap accessibility. When you move into the private business realm, those spaces are sort of a snapshot in time, and we don't necessarily enforce the maintenance and the continuation of those spaces in communities. And so the laws are on the books for a reason. I think bringing understanding not just to the people that are using the spaces, but also the ones that need to maintain them, whether it be striping or proper signage, so that the people that are in need of using these spaces have the ability to continue to use them and access the same spaces that able-bodied people can access.
And Senator Cohen, there's been a lot of movement and a lot of success, it sounds like. What would you like to see done beyond the bill?
Well, I think this bill is a result of collaboration and advocacy from individuals with disabilities who've really fought tirelessly for their rights, and the people who care for them and love them. It's really a testament to the power of grassroots activism, things like this, where we see our constituents bringing us issues and wanting to see and bring about change, and the importance of us listening to and amplifying those voices, particularly of marginalized communities. So I think, as lawmakers, it's our duty to protect the rights and improve the lives of all of our residents. I think this bill is an important step towards creating a more inclusive and accessible society. So I do think, just by having these discussions, I think by the Placard Council meeting regularly and us understanding more about the issues, particularly with those in the accessibility community, I think we'll understand more about what next steps need to happen. So I'm so happy that we were able to work together to get these things done, and looking forward to see what the council brings.
And just real quick final thoughts for both of you, Representative Candelora. What do you hope listeners can take away from this conversation today?
Yeah, I think, it's a complicated, difficult issue because it involves so many different people that come into play, our healthcare industry, the business industry, our towns and communities, our Department of Motor Vehicles, that we have to continue to talk about this. And that's why I think the council is a great step. And what the Caruso and Bode family have done with advocacy and educating people, that it's when you're using a handicapped space, if you don't really need it, you're actually potentially taking away the ability for somebody else to be able to use it and have the same access and mobility to places that able-bodied people are going. So I think this is a great step to start this process of really trying to tamp down on people who might not be intentionally misusing these, but just not thinking about it, of how it impacts people when you're overusing or abusing the handicap placards.
Senator Cohen, final thoughts?
Yeah, I agree with that. And I'm, like I said, I think this is really the result of a lot of collaboration and advocacy. I too am grateful to the Caruso and Bode family for bringing these issues to us and helping to enlighten us about the issues the disability community faces. This is just one of them. But I also think it's important, that we continue this work and continue listening and understanding so that we can continue to make progress for not just the disability community, but for residents on the whole, just gaining understanding about what they face every day. So thank you so much.
Well, thank you both for being on today. Transportation Committee Co-Chair Senator Christine Cohen, thank you for being with us today.
Thank you, Catherine.
And House Republican Leader Vincent Candelora, thank you for your time today as well.
Thank you.
And I just want to make a quick note here that the Associated Press guidelines have retired the phrase handicap in favor of disability. And Mary, just some quick thoughts from you as well. You've been listening to the lawmakers here and also heard the news that the bill went through. What's going through your mind?
I'm obviously very happy and excited and appreciative of the support we did receive from both Representative Candelora and Senator Cohen. I think it's important. This bill is important because the way we saw it, it's one of two things: either someone that isn't able to get a placard and feels they can get it online, or two, someone that may not realize that our placards are free. You don't have to spend $150 to get it. And I do want to add that we tested the system, and we had a grad student who was very interested in trying to get an accessible placard and was successful and never actually saw a physician. It was through text messaging, and it was through a physician in Hawaii and a physician in San Francisco. So that kind of clinched the deal for us. So we're excited that we were able to investigate, find a flaw, bring it to our legislators who felt it was worthy, and we think we did a good thing for the general public all the way around. Al, right?
Let's keep that conversation going.
Yeah, she's going to change from start the conversation to keep the conversation going.
Well, that's a beautiful change. That sounds like a good plan there, Al. You've been listening to Mary Caruso and Al and Sam Bode, who are all members of the nonprofit Peace, Love, and Accessibility. Coming up next, we will hear from Connecticut DMV Commissioner Tony Guerrera. What has your experience been with accessible parking? You can join the conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. This hour, we're discussing accessible parking in Connecticut. An Accessible Parking Advisory Council was recently formed within the Connecticut Department of Motor Vehicles to look into how accessible parking passes might be better regulated and enforced, and the many stakeholders that would be involved in that process, from medical providers to law enforcement. And joining us now is Connecticut Department of Motor Vehicles Commissioner Tony Guerrera. Commissioner, thank you so much for being on Where We Live today.
Thank you, Catherine, for having me on.
And so I want to give you a chance to respond to the discussion that you've heard so far this hour. Did anything jump out to you, Commissioner?
Well, again, I think it's a discussion that has been talked about, obviously, for a number of years. But finally, I think that through the leaders of the legislature, as Representative Candelora and Senator Cohen, and this task force that we've set up, is hopefully to get our arms around this and how we can make sure that people who are handicapped have the accessibility to get to places without being inconvenienced. And I think that having this council and having the right people on it, Catherine, is important. When we say the right people, law enforcement, people like Ms. Caruso, who was just on the phone with us, people at the Department of Motor Vehicle, medical professionals, handicapped individuals, to share their perspective of how we can change this and to make it better for everyone in the state of Connecticut.
And so this council, we've been talking about the Accessible Parking Advisory Council, has met twice since March. And the Connecticut Examiner reported that the council will report back to the state legislature by January 2025 on how to better address placard fraud. So, Commissioner, can you give us a sense of what's happened so far? You know, any early goals that you've identified, anything that you're prioritizing right now?
Sure. We've met, obviously, we're going on our third time within the next, I think, couple of weeks, we're meeting again. So with that, though, we talked about, obviously, what is the number one issue that we see. One is the enforcement issue, right? That how do you determine a placard is expired? How do you determine that individual truly does have one? Is it accessible for a law enforcement individual to read the placard enough to see if it isn't or not? And these are some of the takeaways we've seen so far in our first couple of meetings. And that is, maybe we need to revamp the placard, maybe to make it in a sense that the placard the year the placard stands out, where it shows like that you have this placard for maybe, I think it's up to 2 years, is it? Or maybe 1 year. I got to check what it was. But let's just say, Catherine, that you have a placard for 2 years, and on there would show that you would have it from 2024 in bold numbers to 2026. So therefore, it's very visible to someone who is using that parking spot that they should be in that spot. And if it's not, then it gives warrant to whether a citation or to be notified to the DMV or to law enforcement.
And so we've talked about lifetime placards that are kind of still out there. What is your sense of the number of those placards that are still in use? Because I think back in 2010, before they were phased out, at that time, there were roughly about 300,000 tags that were still in use. And this was reported out from an NBC report from the DMV. And we've also just talked to the Bode family and Officer Murgo, who have observed those placards that are still in use. So do you have an idea how many of them are still out there?
Yeah, it's a very difficult number to get because it was a lifetime placard. We have not issued any more lifetime placards. To your point, Catherine, since 2010. What the issue is, and I'll be quite honest with all your listeners and yourself, is that how do you know they're still out there? Because people don't return them back in, and we can ask for them to be returned back in, but some of the comments we've received is that I don't have it anymore, I've discarded it, whatever it is. So it's very difficult. We've seen that number come way down in regards to some of the stats that we've seen, whether it's through police reports or whatever, or law enforcement. So that's a good thing over the last 14 years that lifetime placard has drastically been cut down. So that's a good thing. But the other issue is, as we know, is that we just can't have medical providers willy-nilly just signing off on any type of someone comes in with a diagnosis that maybe isn't quite handicap placard accessibility that they should have one. And that's why we put medical professions on this advisory council. We want to hear from our local police officers and so forth to make sure that what do they see? You know what I mean? And that we looked at other states, Catherine. To be quite honest, we looked at some states that, where the fines are pretty drastic. If you're parking in a handicap placard and you shouldn't be there, it's not a $20 fine or a $50 fine. Some of these fines can range up to $500. And therefore, it sends a strong message not to ever do something like that again.
And well, speaking of fines, can you talk about how many infractions related to the lifetime parking tags have your office logged? Or do you have a sense of the scale of this issue?
I don't have the direct numbers or the accurate numbers to speak right now. I could find those out. But again, it's a tough situation because I remember as a former legislator on the transportation committee talking about this back to what you said to back 2010, and I get a sense that it's hard because say you go like I remember the Caruso spoke to me about this. You go into a Walmart or a Target or whatever it may be, or a Stop and Shop, and you see those places there, all right, and people pull in, all right, but that they shouldn't be there. But by the time you get law enforcement out there, or maybe they may say at the time that, that's private property, we're really not going to come out to do any enforcement or whatever it is, and therefore nothing gets done. I think the tide has turned where law enforcement is working very closely with the advocacy group and people who that are very passionate about this to start making those passes in private areas because that's where we see it the most, and therefore give them the citations that unfortunately they deserve.
And with the many movements happening, we also know here in Connecticut, a lot of proposed bills do get sent out to research committees. And we know a good amount of DMV research led to the phasing out of those lifetime parking tags in 2010 that we mentioned earlier. Commissioner, can you talk about what are your hopes for this council and actions that might be taken in the future?
Well, again, my hope is to let's not try to basically come into this council and come out of this to try to change so much that nothing gets done. My focus is to listen to the people. Let's try to get 3 items that are so important to everyone, and let's get them done. I'm a big proponent of that, Catherine, to get things done in a way that can have a big impact in a short time frame. And to keep this council maybe going, to keep looking at this, and to keep making changes. Not to put it aside, right, that we've done this. We did 3 things and I'll put it aside and nothing gets done for the next 10 years. But to keep coming back to this within maybe every year or every 2 years, to keep making changes to better equip people who need that placard and to make sure they have the accessibility just like everyone else that they deserve to go to point A to point B.
Well, we'll definitely be following up on this. Connecticut DMV Commissioner Tony Guerrera, thank you so much for your time today.
Thank you, Catherine.
And Mary, I want to bring this back to you for some final questions of the hour. You've been listening to what the commissioner has to say. Anything jumped out to you, Mary?
Thank you for that question. I mean, first and foremost, we're so grateful for the interest in the commissioner. He's an extremely busy person, and he's really given a lot of thought into what the members of the council are saying. One thing that jumps out at me, because we thought about this as we were visiting police departments, like, what can we do to make change? And every department has said to us, what can we do? So we decided to start asking departments to think about doing one targeted enforcement or community awareness piece a year. And there's about 95 police departments in the state of Connecticut. So our thought is, if we could get half of them to do one targeted day in their communities, it would be about once a week. And what better public awareness piece is that? So, so far, everybody is committed to that, which would mean they'd be out for one day, and they'd be either, pulling illegal placards or just talking to the community about accessible parking. And we think that's a huge, that will make a huge difference. Al, agree?
Yeah,
Yeah, it's a great way to keep that conversation going. As Commissioner Guerrera said, to keep that council going. I think it's important to continue to remind everyone that the placard program is something that needs to be respected, understood, and adhered to.
And I think one of the themes today, too, is I think every person has mentioned some sort of broader misconceptions that they like to address, whether it's, switching up the placard or assuming that you can park at a spot that you're not supposed to be parking at. And can you talk about some of your misconceptions that you would like to address, especially when it concerns the disabled community around where we live? And how should we be rethinking this, Mary?
Yeah, I think two things that we as a family talked about and adhere to, that I think a lot of people don't agree with, but that's okay. If Sam and Al are going out into the community, they don't drive, their assistants drive them. If they're going to a store and they are not going to be going to the store, we agreed that they would not use an accessible spot. Because after all, it is for access for the person with the disability. So their assistant doesn't have one. So we see that as helping fellow placard users. We're not going to take up that spot if they don't need access to get into where they're going. So that's one of the things that we see happen a lot and could help improve accessibility among placard users. The other thing that we see a lot, and we've talked about, say they go into a restaurant and they're getting lunch with their assistant, and they come out and they get in the van and they're going to eat their lunch for a half hour. Move out of the spot. They can eat lunch anywhere. So, we see those as ways for, our fellow placard users, we could help each other in thinking about what we're doing, being mindful of those spaces. So nobody really brings those up, but we try to bring those up when we have conversations with other placard users. Al, do you want to add to that?
The thing I feel and people buy that
Right. As we've talked about through this hour, is that access aisle parking, people just really, it's not a spot. And that it's just not okay to pull in to grab your coffee. It's just not okay.
Well, Al, we appreciate you expressing your thoughts. And I also want to ask Sam, you've been listening to what your mom has to say too. What should we be rethinking about this community here?
I think we should always have a positive attitude. discussing these with different people.
Yep. Always be positive. You're absolutely right.
I mean,
Sam.
that sounds like a great note, really, for all of us. We can all use a little bit more positivity. And Sam, just really quickly, too, any final thoughts that you would like to share? What do you hope our listeners get out from this conversation today?
Like don't park in an accessible spot. Don't park in the hashtags, and don't don't eat lunch in a handicap accessible spot.
Yeah. Don't park it. You don't need it.
Sounds like Al might have a final thought, too.
Al?
Yes.
You've started the conversation. Now it's up to the community to keep it going.
Go ahead.
Keep it going.
Well, thank you so much for helping us keep the conversation going, Al and Sam. And Mary, just also really quickly, your final thoughts here too. You've been here this entire hour. There's been a lot going on. What do you hope our listeners take out from this conversation today?
Well, I hope everyone realizes that this is a conversation that has been long coming. And we've really struggled with trying to get the attention that it really deserves. And it's exciting to see so many people interested that I hope it does make a difference. And I hope simple awareness does help people understand that it's nothing to be complacent about. It's a real need for a real group of valued people.
Well, thank you all so much for starting and keeping this
Thank
conversation with us. You've been listening to Mary Caruso, Al, and Sam Bode. Thank you all so much for being on Where We Live today.
Thank you.
Thank you. And for our listeners, you can learn more about peace, love, and accessibility on our website at ctpublic.org/where we live. I'm Catherine Shen. Today's show is produced by Katie Pellico. Our technical producer is Kat Pastor. Download Where We Live anytime on your favorite podcast app. And thank you so much for listening.